Today, we have a great topic: health insurance. This is one of the most complicated and, quite frankly, frustrating parts of healthcare, but that is why I am here today. I am going to hopefully explain healthcare in a way that makes sense and reduces the friction that you and the health insurance companies have. Today, we're going to reframe healthcare. We're going to come to a better understanding of the terminology and the lingo of the healthcare system. We're going to talk about how the United States does healthcare, how other countries do healthcare, and how the United States could improve healthcare and how you could improve your current healthcare situation. If any of that sounds interesting or realistically useful to you, stick around. This is going to be a good one. But before we jump in, one quick ask. Most of you who watch this show or channel aren't actually subscribed. If you could hit the follow or subscribe button on whatever platform you watch me on, I would deeply, deeply appreciate that. It helps me continue bringing high quality medical and health content to you for free. Thank you. One of the most confusing and, quite frankly, frustrating things about healthcare and insurance is all of the terminology that seems foreign and clunky and very confusing. So let's get into the terminology and break down these words that you've probably heard but might not understand one by one. First up, we have premiums. Premiums are like a monthly subscription. You pay a set cost each month to your health insurance provider, and they open the door for all of the benefits in that specific plan. However, unlike your Netflix subscription, paying your monthly premium doesn't get you unlimited access to care. It keeps the door open, but it still might cost you. And here's a common misconception about monthly premiums for you. Your monthly premium doesn't count towards your deductible or your out-of-pocket max. So even though you're paying every month, they don't help you reach these important milestones. Only things like paying for exams, tests, or procedures are actually going to go towards those numbers. But what exactly are those numbers? The deductible is going to be the amount of money that you have to pay out of your own pocket before the real benefits of your plan start to kick in. So let's say your deductible is $2,000. This means that you have to pay out of pocket $2,000 on those tests, exams, and procedures before your insurance starts to help out. This is where coinsurance comes in. Coinsurance is the amount that you and your insurance company split after you've met your deductible. So for instance, if you look at the surgery section of your plan, it might say something to the effect of coinsurance and 30%. What this means is that after you've met your deductible, your insurance company will pay 70% of your surgery, but that still means you're on the hook for 30%. And in the world of surgery, this can still mean thousands, if not tens of thousands of dollars. But that's where the other number we mentioned earlier comes in, and that's your out-of-pocket max. As the name suggests, this is the maximum amount of money that you would actually have to pay out of pocket in a calendar year for healthcare. So back to the surgery example, if that 30% that you have to pay is $20,000, but your out-of-pocket max is $8,000, you only have to pay up to that $8,000 mark. So if you've met your $2,000 deductible and you have to get this surgery, that means you would only have to pay $6,000. Only $6,000, right? But it still does help out because it means if you have really expensive procedures or medications or anything of the sort, there is a limit on how much you actually would realistically have to pay. One last thing we have to talk about are copayments, or copays for short. These are flat fees that you pay for specific services, like $20 for your primary care or $150 for the emergency room. You normally have to pay copays before you hit your deductible, and in some plans you have to continue paying them even after you've hit your deductible. And in plans with a really high deductible, they might not even have copays, and you just have to pay out of pocket the maximum cost every time until you hit that deductible. And one more thing to talk about is network. So you may have heard that you have in-network and out-of-network doctors. In-network doctors have made a deal effectively with the insurance company to have you pay a fixed rate, whereas out-of-network providers have not done this. And what this means practically is that in-network doctors are going to be way cheaper and out-of-network doctors are going to be way more expensive. So let me leave you with a quick tip here. These four numbers, your out-of-pocket max, your premium, your deductible, and your copays, are the things that you really should be looking at most with your insurance. Balancing these four numbers and looking at what you plan to use or what you expect to use can really help you decide on what kind of plan is going to be best for you. Now that we've unpacked the key terms, let's actually get into what kinds of plans you are likely to see when shopping for or looking at employer-offered health insurance. The first big one are HMOs. HMOs are health maintenance organizations, and what they are health insurance plans that normally have lower monthly premiums with higher deductibles. Furthermore, they also normally require you to have a primary care doctor as your keystone healthcare provider. And what I mean by this is that your primary care provider has to refer you to specialists and they have to order labs for you to actually get them. They also usually have a much smaller network than other kinds of plans, meaning that you're a little bit more limited in terms of what doctors you can actually see. This kind of plan is going to be great for people who are younger and healthy and really don't expect to need a whole lot of doctor's appointments. Next up, let's talk about PPOs. PPOs are preferred provider organizations, and they're almost the opposite of HMOs. Unlike HMOs, a PPO will have a much higher monthly premium, but normally a lower deductible. Furthermore, you'll have a lot more flexibility in terms of what kinds of doctors you can see. You might not even need referrals to go see specialists. Out-of-network doctors are also going to be a lot cheaper under these plans normally. However, you do pay for this with the higher monthly premiums, and because of this, PPOs are going to be really good for people who have ongoing or complex medical issues that require them to see the doctor pretty frequently. They cost more upfront, but in the long term, they can actually save you a lot of money since you don't have that high deductible and you have a lot more flexibility in terms of what doctors you can see. Finally, let's talk about HDHPs, and these are high deductible health plans. As the name suggests, they normally have a pretty high deductible. The monthly premium is generally low, almost like the HMO. However, what makes these plans a little bit different is that they oftentimes come with a health savings account. A health savings account is a savings account, but with certain tax breaks that are really beneficial for you. So in a word, a health savings account is an account that you put money into that you plan to use for medical expenses later. And they come with some important benefits. The first one is that the money that is in a HSA can grow tax-free. So if you invest it, you don't have to pay taxes on those earnings. If you did this in a normal savings account, you would actually have to pay taxes on those earnings. Second, your contributions are tax deductible. This means if you put money into an HSA, you can actually deduct this from your income when you file your taxes. This can help you get into lower tax brackets and allow you to get more money back when you actually get your tax return. Finally, the withdrawals from this account are tax-free as long as you're using them for medical expenses. This is a triple tax break, and this is actually really, really rare in the financial world, so these accounts are actually pretty awesome. Finally, there's a couple of other ways that people can get insurance. There's government-funded insurance, think Medicare and Medicaid. Medicare is going to be federally funded and for people over 65, whereas Medicaid is going to be state funded and for people of lower income. There's also military insurance like the VA or TRICARE, and of course there's private health insurance and people who are uninsured. And this leads us nicely into the actual landscape of healthcare in the United States. The United States operates on what is called a mixed multi-payer healthcare system, and in a word, this means that people get their insurance from a wide variety of sources. The biggest one is going to be employer-funded healthcare. This is where around 54% of Americans actually get their health insurance from. 36% of Americans are covered by government-funded programs like Medicare or Medicaid. 10% opt to pay for private health insurance. Around 2.5% are going to be covered by the military, so VA and TRICARE. However, this actually leaves around 8 to 10% of Americans uninsured, which is millions and millions of Americans. And this leads us into the segment of the video where we critique the American healthcare system and the insurance that you have to pay for. The biggest and most pressing critique is the sheer cost of it. Health insurance is incredibly expensive. In recent years, deductibles and premiums have been going up way faster than inflation and way quicker than wages. What this means is that even the base cost, the monthly subscription fee that you pay, is going to cost you a lot more than it would in previous years. And because of the high deductibles, you might not even be able to get the savings from your health insurance plan without spending thousands and thousands of dollars. This leads to a phenomenon called underinsurance, where you technically have health insurance, but it costs so much that you actually just don't really get the healthcare that you need, and it's not very practical for you. There's other big issues too, like the Medicaid gap. The Medicaid gap is really shitty. Basically, it's when you make too much money to apply for Medicaid, but you don't make enough money to afford private insurance, or your employer doesn't offer good employer insurance. This is pretty much a catch-22, and you slip through the cracks and you end up not being insured or having really poor insurance. Not very good. There's also the administrative chaos that is the insurance system. I'm sure many of you will have seen the South Park episode that they did on this, and it's like frighteningly accurate and really disconcerting because navigating the system is so complex. There's so much paperwork, there's so much BS, there's so many hoops that you have to jump through, and that just makes it more difficult and even more expensive. Americans spend roughly $1,000 per year on this administrative bloating, which is around 5 times higher than comparable wealthy countries. There's also the issue of the claims and appeals process. Up to 19% of in-network, not out-of-network, claims that are made to insurance companies get denied. This means that if you get a healthcare service and it gets sent to the insurance company, there's up to a 19% chance they just won't cover it. However, you can appeal and try to get it covered anyways, but this process is time-consuming, expensive, and very energy-consuming, and unfortunately isn't really worth it because around 50% of appeals aren't overturned, meaning that 50% of people who try to get their claims covered don't actually get them covered. These are but a couple of the issues, and they lead to real-world consequences. Many people delay or forego care altogether because it just costs too much. I can't tell you how many patients I've had who need to go to the emergency room with an ambulance because they are in a really critical, acute situation, and they just don't. They either drive themselves or refuse care because they don't want to pay for it. Many people will also skip preventative screenings, meaning that big health conditions like cancer, hypertension, etc. can get missed because they're just not going to the doctor regularly. In a similar vein, chronic conditions can go unmanaged, so you may have a diagnosis, but you don't go to the doctor to treat it and you don't get your meds because, again, it's too expensive. And finally, all of this financial stress can make all these problems way worse. We've talked about stress in a previous video, and stress has global effects on your body that are ubiquitously negative, in the long term, that is. And predictably, these outcomes hit lower socioeconomic individuals the most because they're the ones that are not only most affected by the financial burdens of healthcare, but also by just worse health outcomes to begin with. So it's this nasty synergism for these people where they can't get the care they need because it's too expensive, and they also have worse health outcomes in general. Put these two together and the health outcomes just get abysmal. And real quick, let's compare the US to a couple of other wealthy comparable countries with a couple of unsettling facts. So as I stated earlier, around 8 to 10% of the US population is uninsured. Compare this with other countries like Japan, Sweden, Switzerland, and these countries have around 100% coverage for all of their citizens. Perhaps the most oft-cited and striking statistic that is talked about in terms of the US healthcare system is the fact that the US spends around twice as much per capita on individuals for health insurance, and the health outcomes are not as good as other countries. One of the biggest health outcomes that's looked at in this regard is life expectancy, and in other countries, life expectancy is notably higher than the United States. Japan reached almost 85 years, Switzerland 84, and France 82, whereas the United States lags behind at 78 years for life expectancy. But before we get into some reforms and individual things that you can do, I do want to talk about some of the good aspects of the American healthcare system, because there are indeed good things, and I would be very remiss not to talk about them. So the first big one is innovation and cutting-edge medicine. The United States has a very competitive and private healthcare system, and because of this, there's a lot of money poured into research and development. This means we have very cutting-edge innovations for procedures, technologies, and drugs, far surpassing many other countries. And because of this, we have a much higher access to world-class specialists. If you need an ultra-complex procedure done, something that only a couple of people in the world can do, there's a good chance that they're practicing in the United States because we have the resources and technology for them to actually do the procedure. And finally, this one's a bit of a double-edged sword, but we have a lot more flexibility for insurance. Some countries have compulsory insurance where you just have one option and that's all you get. In the United States, we do have access to a lot of different plans and companies that you can choose from. The catch here is that a lot of these plans cost so much that the choices that you actually have, realistically, aren't that many. But now that we've unpacked the good, the bad, and the deeply dysfunctional, what's next? How do we move forward? So we talked about other countries a little bit and how their health outcomes are seemingly better for spending less. So how do some of these other countries do healthcare? So many countries like Canada, the United Kingdom, Germany, and Japan have a single payer system. This means that the people in the country will pay taxes that go towards healthcare, and then everyone gets covered based off of that. It's a lot less convoluted than the American healthcare system. Here's some charts. If you go by Occam's razor, sometimes the simplest solution might actually be the best. So in these countries, there is little to no out-of-pocket cost, and everyone gets covered. Now, it is important here to note that it's not necessarily free, as many people seem to claim it is. You still pay for it in taxes, but the process is just a lot more streamlined. And after you've paid your part in taxes, generally you don't actually have to pay more. By contrast, the United States is pretty much the only wealthy country that doesn't guarantee health coverage for all of its citizens. As I stated earlier, countries like the UK have an entirely tax-funded healthcare system, whereas countries like Japan and Switzerland have compulsory private healthcare that everyone has to pay for. However, in this latter example, like in Japan, there are income-based premiums. So you pay more if you make more and you pay less if you make less, but everyone still ends up getting health insurance. These systems keep healthcare affordable by spreading the risk across the entire population and keeping prices down. And that's why even though Americans spend more per person on healthcare, in these other countries, the out-of-pocket costs for citizens are actually a lot lower than the United States. And this is why some of the health outcomes like life expectancy or chronic disease management are better in these countries. Now, a quick caveat here, the United States is different from a lot of these countries in a couple of key ways. The first few are that it's a lot bigger and a lot more diverse. Now, this isn't necessarily an excuse to not try to have systems similar to these other countries, but it does make it a lot more difficult. Furthermore, after World War II, the United States pursued this private health insurance model, whereas the other countries pursued a public health insurance model. And totally reversing this private health insurance model would be practically impossible to do, which is why in the United States, it makes a lot more feasible sense to make slow tweaks over time to make the system a lot better. So let's go through a lot of these solutions and improvements that are being tested. The first one is continuing subsidies for the Affordable Care Act. Despite some of the criticisms of the Affordable Care Act, it has helped millions of Americans get health insurance. And making sure that it actually has the money to do this will keep more people insured in the long run. Filling the Medicaid gap that we mentioned earlier would also be very beneficial, so putting more money aside so that people could actually get Medicaid in this gap would help insure millions of people. Simplifying enrollment and maintaining coverage is another thing that's being tried, and I think this one would be great. If we could simplify the system and reduce administrative bloat, this would help tremendously. Furthermore, automatic enrollment and continuous 12-month eligibility could help people stay insured, especially during gaps in insurance. Making insurance more affordable via laws that Congress passes could help as well. Setting price maxes on things like premiums, deductibles, or medication prices could help drive costs down for a lot of people. Addressing medical debt is also another big thing. Some states are passing laws to cap interest rates on medical debt. This means that you wouldn't be paying exorbitantly more in the long run on this debt. Controlling costs over time is also going to be really helpful here. Again, reducing administrative bloating would be awesome, and then also having laws passed that could negotiate prices for drugs and hospital costs so that these things weren't able to run amok like we're seeing now. A great example here is Ozempic. Ozempic costs pennies on the dollar to make, maybe up to $5 from what I read. And in the United States, the name brand Ozempic from a pharmacy can cost upwards of $1,000 per month. This is a thousands times markup in price, and having laws that prevent this kind of thing from happening would help. And because the United States does have a very unique way of governance, we have state governments and federal governments, and a lot of times the state governments can take precedent. Allowing states to become more innovative with how they implement health insurance could help here a lot as well. No one policy is going to solve everything. We're not going to be able to snap our fingers and have a health insurance system like many of the countries in Europe or Japan. However, if we aggressively tackle this problem with a combination of solutions and we can get more of the public on board, this is going to help tremendously, as well as electing lawmakers who are actually going to pass these laws. Expanding subsidies, filling coverage gaps, and managing costs are going to be huge in this process. And in my opinion, it seems very plausible that we can do this over time. Although the United States is drastically different from a lot of these countries abroad and in Europe, I think we could learn a lot of valuable lessons from them. And if we could implement some of these lessons and improve health insurance, make it cheaper, and have more people insured, I think this is something that we could all agree on. And finally, beyond all of the administrative and governmental and policy-making decisions, what can you individually do about your health insurance situation? So, like many other things in life, health insurance is a problem for a lot of people, and because of this, I think we can have some general problem-solving heuristics to solve it. The first one is to identify the problem that you have. Is your health insurance too expensive? Do you need more coverage? Do you need perhaps less coverage? Are you paying too much for care that you don't necessarily need? The first step in solving a problem is identifying it. So doing some self-reflection, asking yourself what you need, what you're willing to pay, what you're willing to do, this is going to be the first step. And then once you've actually outlined what you need, then you can begin to research what options you actually have. Looking at what your employer might offer. safer, finding private options in your budget, seeing if you qualify for government assistance. These are all things that I think are going to lead to solutions to this problem for many people. If you're in that Medicaid gap, it can be very difficult, but looking at all of your options and deciding where you actually want to make trade-offs and sacrifices is also going to be important. Exploring marketplace options through the Affordable Care Act is also a good option for a lot of people. I think it's also pertinent to consider seemingly extreme options if that is possible for you. If you could switch your job, for instance, to get better access to health insurance, this might be worth looking into. Unfortunately, I can't really give a one-size-fits-all piece of advice here because each person's situation, needs, and abilities are going to be very different. So you're going to need to see what's going to work best for you and go from there. And this is going to require some self-reflection. What do you need from your plan? Are there specific medications or services that you need? What's your budget? And once you've looked into this, do your research, see what options you have, and go from there. And one final thing to note here, oftentimes health insurance can seem like a very personal problem, but oftentimes it's really good to get out there and talk to other people. Talk to an advisor or broker and get advice from people you trust, sources you trust, and really lean on the collective wisdom that we have, especially on the internet. Use that tool. Nobody ever said it was easy, but hopefully after today, you understand the American health insurance system a little bit better and you're a little bit more equipped to deal with it. Whatever your situation with health insurance is now, I hope that after today, you'll be able to approach it in the future with a lot more clarity and a lot more confidence. Thank you so much for watching today's video. If you got something out of it or enjoyed it, subscribe, like, share it with friends and family, people you might think that it could be useful to. It really helps a lot. And as we all know, better understanding leads to better choices. Thank you again, and take care.